Dear the fourth Inatem committee and also all participants, thank you for the opportunity. Today, I am Yusuf Arimasuri, would like to present our study entitled Impact of the COVID-19 Pandemic on TB Care in two cities in Indonesia. The COVID-19 pandemic that started since 2020 have a lot of impact, including disruption in economy, social, health, and etc. The disruption also happened in non-COVID-19 health services, including TB services. Several studies show that the COVID-19 pandemic has affected the continuity and quality of TB care worldwide. Systematic evidence of the long-term impact on COVID-19 in TB service and cascade of care, however, still limited. Therefore, in our study, we discuss our preliminary findings on access to TB health services in two cities in Indonesia before and during the first year COVID-19 pandemic. We conducted a retrospective cohort study in Yogyakarta and Bandung using Sistem Informasi Tuberkulosis Terpadu and Sistem Informasi Tuberkulosis datasets. We observed two periods of the dataset that are 2019 or before pandemic and 2020 or during pandemic. We use a framework for the cascade of care that included the notified, started treatment, completed treatment, and successful treatment of the TB patient. Our preliminary findings showed that in Bandung and Yogyakarta, the patients both in 2019 and 2020 were predominantly by male patients. However, we find a different pattern of age groups of the patient in Bandung and Yogyakarta. In Bandung, in 2019 and 2020, we see that patients were mostly come from the age group of 21 to 40 years old patients. But in Yogyakarta, we observe differences. In 2019, the patients were predominantly by patients in age group of 21 to 40 years old, but in 2020, we see that the patients were mostly come from age group of 41 to 60 years old. In the term of cascade of TB, we also observe similar and different pattern. Firstly, we see a similar pattern of the decrease of each cascade in Bandung and Yogyakarta in terms of absolute number. As we can see here in the slide that in Bandung, we see that the patient in during COVID-19 period or in 2020 were lower compared to the before pandemic or 2019 cascade. In all of the cascade from notified, started treatment, complete treatment, and successful treatment. However, the proportion of the decrease were relatively lower before pandemic, as we can see here. The line both of the 2019 and 2020 were lower, but if we compare, the 2019 were lower compared to the 2020. However, even though the same pattern of absolute number were observed in Yogyakarta, that the same finding with the Bandung, we see the differences in the proportion. In Yogyakarta, we see that the proportion were consistently lower, also in the started treatment, complete treatment, and successful treatment. That is different from Bandung. Our preliminary finding showed that the COVID-19 pandemic negatively impacted the TB cascade. This might also affect the national goals on the TB and also the target of NTB 2035. Therefore, we think that innovative national and local policy on TB program is needed that might be included financing policy, healthcare workforce policy, and also information and technology policy. Moreover, TB services innovation is also needed. We can improve our TB services in several aspects, such as prevention program, case finding, drug distribution strategies, and also virtual or online counseling. Regarding our different pattern of the finding, we think that we need an in-depth investigation on factors associated on the different pattern, such as local policy, healthcare capacity and resilience, and also local resources. Moreover, we think that the other impact of COVID-19 on TB health services also need to be investigated. That might be included the workforce and also patient perception, health expenditure, and also infection and prevention control. In conclusion, our study showed that the COVID-19 pandemic affects the TB cascade of care. Moreover, we also think that the importance of efforts to intensify services to mitigate the impact of COVID-19 on TB services. Thank you very much for the opportunity. Bye.